Hello everyone, welcome to my YouTube channel. It's your girl Sassy D. For those watching me for the first time, you are welcome to my YouTube channel. If this is your first time watching me, kindly click the subscribe button and hit the bell notifications to always get my uploads. If this is your first time watching me, you are so welcome to my YouTube channel. Okay, thank you. Thank you so much for those that have shared my video, for those that have liked and comment. Thank you so much. It is much appreciated. Okay. Thank you so much, guys. Do not forget to hit the subscribe button. It means a lot to me and costs you nothing. So thank you. Let's get straight to the video. So in today's video, we will be talking about miscarriages. What is a miscarriage? What can cause you to have a miscarriage? Okay, and different types of miscarriage. We'll be splitting the video into 3 parts. So this is part 1 of 3. Okay, so part 1. A miscarriage is the natural death of a fetus before it is viable, usually in the first 20 weeks of pregnancy, medically termed spontaneous abortion. Miscarriage is one of the most common pregnancy-related issues. The American College of Obstetricians estimated that about 15 to 20% of clinically recognized pregnancies end up in miscarriages. Although it is common, it can be an extremely traumatic, devastating experience. Now, if you've ever had a miscarriage in the past, you know it can be very painful. So, sorry about your miscarriage. If you've ever had a miscarriage, it is quite traumatizing. It is not an easy experience. So, I would be breaking down why you have a miscarriage and the types of miscarriages, so stay tuned. Many women may have miscarriage before they know they are pregnant or before it has been confirmed by a healthcare provider. Women whom are under the age of 35, the risk is 10%, but it is much higher in women 40 plus. The risk is 45%. Most women who have miscarriage go on to have healthy pregnancies after a miscarriage. After one miscarriage, the predicted risk of miscarriages in future pregnancies is usually about 14%. It increases to about 20% after 2 miscarriages, after 3 to about 28%. Now, that's quite high. So, there are different types of miscarriages. Number 1 is threatened miscarriage, which are women may experience signs of miscarriages such as bleeding with lower backache, but the loss of pregnancy hasn't yet occurred. Number 2, incomplete miscarriage is where some of the tissue from the pregnancy has been expelled from the uterus, but some remains. Number 3 is complete miscarriage, is where all the tissue from the pregnancy are expelled from the body. Number 4, missed miscarriage is where the embryo dies but the body does not expel the pregnancy tissues and no symptoms such as bleeding or pain are experienced. Number 5, recurrent miscarriage. It is where the occurrence of multiple consecutive miscarriages. Number 6, septic miscarriage. It is where the tissue from a missed or incomplete miscarriage become infected. When a miscarriage happens, most women tend to blame and put all the blames on themselves. Now, some miscarriages happen for reasons beyond our control. In most cases, there is no way to prevent a miscarriage. Even if you have done everything right, you cannot stop it because of some reasons I'm about to list below. Miscarriage can happen for various reasons, including an abnormal placenta development, that interrupts with the flow of blood from the mother to the baby. Another one is chromosome abnormalities in the baby. About 50% of miscarriages are due to chromosome issues like weakened cervix, abnormally shaped womb, poor diet or malnutrition, food poisoning, certain medications, uterine abnormalities. Other causes like underlying health conditions such as high blood pressure, diabetes, kidney disease, HIV, malaria, gonorrhea, thyroid gland problems, lupus, so on and so forth. Risk factors for miscarriages include the following: obesity, older, maternal age, previous miscarriages, illicit drug use, alcohol abuse, smoking, being underweight, exposure to workplace hazards such as radiation or toxic agents, caffeine, so on and so forth. Some symptoms you may experience during a miscarriage: vaginal bleeding, lower abdominal cramps, spotting, pelvic pain, lower back pain, uterine contraction, vaginal discharge that looks mucousy as a white, pinkish color, disappearance of pregnancy symptoms such as morning sickness, breast tenderness, weight loss. How miscarriages are usually diagnosed. The following test is used to diagnose miscarriage by transvaginal ultrasound placed into the vagina to check for the heartbeat of the embryo or fetus. Blood test to check hormones that are associated with pregnancy. A pelvic exam to assess the cervix for thinning or any opening. Prevention. Most miscarriages cannot be prevented as mentioned, but precautions can be taken to increase your chances of a healthy pregnancy. These include no alcohol, no smoking, maintain a healthy weight before pregnancy, meaning try to be average and not overweight, obese, or underweight. Eating a healthy, balanced diet with plenty of folic or calcium. Taking prenatal vitamins daily, limit the caffeine intake, attending all scheduled appointments, as well as discussing all concerns with your doctor. Lighter exercises to increase fetal health. It could be yoga, walking, etc. Thank you so much for watching. You are truly appreciated. Don't forget to share, like, and subscribe to our YouTube channel. We truly appreciate the love and the support. Thank you guys. See you on the next video.